Hi everyone. Today I'm going to talk about my project, which is addressing the health literacy deficit. Can integrating personality traits improve healthcare decisions? So a little bit about our background. We found some studies that show that there are multiple factors that influence health insurance decisions, and that there's also a relationship between economics and personality psychology. One of the biggest influencing factors is health literacy, and this can impact the decisions individuals make when it comes to health insurance plans. We also found that personality can impact health-related behaviors, and our biggest source for this was the Term and Longevity Project. And this is a 70-year project which looks at the lifestyle and health and personality of different individuals throughout their lifetime. Table 1 shows the characteristics of the big 5 personality traits. So extroversion is associated with being assertive, talkative, sociable, and active. Agreeable is associated with being modest, cooperative, good-natured, compliant, and gentle. Someone who's more conscientious is responsible, careful, thorough, and organized. Someone who is neurotic is insecure, tends to be angry, depressed, or have anxiety. And someone who is open to new experiences is open-minded, sensitive, intellectual, and imaginative. Over the summer of 2020, my advisor and I issued a national survey through Amazon Mechanical Turk, and we got 432 participants to take our survey. Some of their responses had to be omitted because there was some weird data. For example, one person said they had over 5,000 kids, and that seemed a little weird to us, so we omitted it. And there were also some people that weren't from the United States who took the survey, and we were specifically looking at the United States health insurance industry, so we had to omit the results because their health insurance is different from ours. So some of the survey questions included demographics, such as like what is your zip code? Then there was some health history questions, um, some health behavior questions, which would be physical activity, how often you went to the doctor, and so on. Influencing factors would include who influences your preferences for health insurance. So that would include family, coworkers, friends, social media, and so on. The Big Five personality test, which was 10 questions, and people had to give a score of how much they agreed with specific statements, and we then found out their personality type. And then we also included a choice experiment, which I'm going to talk about a little bit further into the presentation. Table 2 shows the coefficients of multivariate linear regression on personality and health behaviors. So our personality variables were the big 5 personality traits: extroversion, agreeable, conscientiousness, neuroticism, and open to new experiences. And our health behavior variables were physical activity, healthy diet, doctor visits, mental health, emergency care, and dental care. All of the coefficients in this table are significant at the p-value of 0.05, and the variables that have the little star next to them are positively impacted by income. And you can read these coefficients as, for example, with a 1-unit increase in extroversion, physical activity would increase by a rate of 0.060 while holding all other variables in this row constant. Another example could be if you look at agreeable, which is right here, a 1-unit increase in agreeable, mental health would decrease by a rate of negative 0.065 while holding all other variables in this row constant. Table 3 was our second regression, and that was the conditional logit regression results. And this one we ran a couple different times with a couple different variables. So this model includes alternative specific variables, which are price and value attributes of each insurance plan alternative. So when we included the choice experiment in our survey, we listed out 9 different questions in total, and individuals had to choose between a plan A, a plan B, or no plan at all. And they had to do that 9 times, so this is where we're getting this data from. So if we look at the negatives and the positives that are associated with different variables like age, health status, extroversion, neuroticism, and premium, we can determine that anything with a negative, the person is less likely to choose plan A or plan B relative to the no option plan. And similarly with the plus sign, a person is more likely to choose a plan, so plan A or plan B relative to the no option plan as well. Premium was also significant at the 0.05 level, while the other variables, age, health status, extroversion, and neuroticism, were significant at the 0.10 level. So some of our results include the big 5 personality traits do impact health insurance behaviors, and this can be seen in Table 2, which is right here. And then age and health status impact an individual's choice of health insurance plan, which is seen in Table 3, which is right here from the conditional logit regression results. And then extroversion also has the ability to impact individuals' preferences for health insurance plan attributes, which is also seen in Table 2. And then premiums are the most important attribute to individuals when choosing a health insurance plan, which is seen once again in Table 3. So for some future studies and implications, we have determined that more studies would be needed to further expand on the relationship between health insurance decisions and personality traits. And more research could prompt a reform in the health insurance industry within the United States, where health insurance companies tailor health insurance plans to individuals and their personality types, rather than just having plans that are supposed to be suited for a wide range of participants. They would be suited more to the individual and how they live. Right. Thank you. If you have any questions, please feel free to reach out to me.